Hi, my name is Gregory, and today I'm going to be performing a trauma assessment. I was dispatched to a 20-year-old female who was ejected from a car during a motor vehicle accident. As I approach the scene, my scene is safe, the police are here, I have on my BSI. My initial assessment is a 20-year-old female lying supine in the road, 10 feet from the car. She has a deformity to her lower right leg and a possible flail segment. I see some paradoxical movement when she breathes. She is my only patient on scene. As I approach, I'm going to request an ALS intercept to help care for the patient. And considering the mechanism of injury as a motor vehicle accident, I'm going to take full C-spine precautions and administer a C-collar. I'm going to begin my primary assessment by checking her responsiveness. Miss, can you hear me? Miss. She responds to painful stimulus when I rub her chest. I'm going to check her airway. It's clear and patent. She is moving air. I'm going to check her breathing. She has decreased lung sounds on the right side and a true flail segment. There is paradoxical movement with her she breathes. I'm going to wrap and stabilize that in order to prevent further injuries. I'm also going to administer 15 liters of oxygen via a non-rebreather mask. I'm going to check her circulation and count respirations at the same time. She has a weak radial pulse of 130 and a respiration of 30 breaths per minute. She has no major bleeding except for the deformity on her right leg, which has minor bleeding. I am going to splint that after my head-to-toe exam. With no responsiveness, I cannot get a sample history, so I will conduct a head-to-toe exam. I will start at the head, palpate the skull and ears. I will check the neck for a jugular vein distension and a deformed trachea. The head is clear. I will check the pupils for reactiveness. The pupils are pearl and reactive to light. I will check the chest, avoiding the flail segment to avoid causing further injury. The left side of her chest is stable. Her arms have no major deformities. She responds when I pinch her fingers, and she has a pulse in both hands. I will move on to the abdomen. I will check for an abdominal aortic aneurysm. There's not one present. Palpation reveals soft in all quadrants. Move to the pelvis. The pelvis is stable and intact. Her legs have no major findings. Her feet have a pulse, and she responds to painful stimulus. Her right leg I will now splint before loading her onto a backboard and manage the minimal bleeding that is there. The pulse on the right foot is present, and she responds to pain. When ALS arrives, we will log roll her, and I will palpate her spine to make sure there's no crepitus fractures. Her spine seems to be stable. We will take a secondary set of vitals. Her breathing is still low on the right side. Her skin is pale, cool, and diaphoretic, so we will also treat for shock immediately. She is a priority transport. Her baseline vitals are a blood pressure of 92/86, a heart rate of 108, respiratory rate is 22. So she is a load and go, and we will reassess every 5 minutes in transport because she is a trauma patient until we get to the hospital and hand off to a higher care. And with that, I'm done.
Oh, God.